Well, there are real concerns about getting care for heart disease patients in these times of the pandemic. I am joined by Dr. Stephen Zweibel of the Hartford Healthcare Heart and Vascular Institute. Thanks for being with us, doctor.
Thank you for having me, Kara.
What about those patients with implanted devices or who need care? How have they been doing throughout the pandemic?
Well, our patients have been doing quite well. We have a long history of remotely following our device patients, and so we've continued that through the pandemic. We've also had a history of using virtual health prior to the pandemic. We were checking the devices and the wounds of our patients after procedures with virtual health, and so it was natural that when the pandemic hit, we wanted to keep our patients safe. We use virtual health along with this remote monitoring of devices to continue providing care to our patients.
Now, some patients may not be used to virtual health. It's certainly more convenient, but people might be thinking, oh, it's not as good. What do you think? Can you give the care that you want to virtually?
Yeah, I think we're providing excellent care to our patients. You know, clearly not every single visit with every patient is best served by a virtual visit, but we found that patients really enjoy the efficiency and the access that they get to physicians using virtual health visits. And certainly the providers also enjoy doing these visits. We have actually, as of yesterday, provided about 193,000 virtual visits to our patients here at Hartford Healthcare since March.
And do you think the virtual health will continue as part of the new normal?
Yes, I do. I think we see it as a way to improve access for many of our patients who might be elderly, live at a distance from us, and who may be appropriate for virtual health visits to improve access to them and also improve the experience. So I do think virtual health visits are here to stay.
And lastly, if you do have to go in, what are some of the safety measures you've implemented to make people feel safe?
Well, clearly we're doing everything in our power to make Hartford Hospital and Hartford Healthcare safe for our patients. We do test every single patient who's coming into the hospital for a procedure or being admitted for COVID, obviously taking the appropriate precautions to isolate those who might be suspected of having COVID. All of the healthcare employees are screened prior to coming to the hospital every day. We all wear masks and we practice social distancing. So I feel these hospitals are incredibly safe, and we really stress that patients who feel that they need to come to the hospital, that they really should not doubt themselves and they should come in to get care if they feel that they need it.
Dr. Zweibel, thank you for being with us.
Sure, thank you.